Hi everyone, it's Lisa. I'm finally doing my 4-month post-op video update. I'm talking really low because everybody's asleep and it's pretty late, and it's the only time that I can do a video because I'm so busy, like we all get in life. So here's my 4-month post-op update video. It is April 23rd, and I had my upper jaw surgery December 5th of last year. So I'm actually over 4 months now. I'm 4.5 months post-op. In my last video, I talked about going to the TMJ specialist appointment and then to an oral surgeon's appointment in May, and then back to the orthodontist to have more brackets removed. Well, obviously things have happened, and so there's been a change. So I'll go over that, and then I'll go over how I'm feeling now and what's changed with diet and numbness and things like that. So I did go see the TMJ specialist just to kind of have my jaw joints evaluated, because I do have arthritic jaw joints from this whole situation that I've had over the years. So the TMJ specialist did recommend that when my braces come off to go back into splints, and he told me that what he thought was that the amount of clenching and grinding that everybody does at night, I actually don't grind too much because my teeth aren't worn down, but I do clench like most people do at night while I'm sleeping. And because my jaw and my nervous system and my jaw joints are sensitive, in his opinion, I can't handle the normal amount of clenching and grinding that occurs, and that most people, well, not most people, that some people are fine with. So I'm going to have to address that situation when the braces come off. The TMJ specialist did feel like when the braces did come off that I would have more pain, and be in more pain because of the clenching at night. So he did recommend that I go back into a splint, which I'm fine with, because I have trauma to my jaw joints. And if you think about it, in any other area of your body, if you were an athlete or whatnot, and you experienced trauma or wear and tear, you would wear a brace when you exercised or whenever you overused that part of your body. So you kind of look at it like wearing a splint in any other part of your body, or a wrap or a brace or something like that. So I'm fine with that. At this time, I am in a little bit of pain. I mean, I say a little bit because I was in extreme pain before, and now I have to kind of look back at the pain that I used to be in and think to the pain that I'm in now. And when I say pain, I'm talking about headaches. I don't get them every day like I used to. They do come when I do clench more at night. And you can tell when you wake up in the morning, your jaw is tired and your muscles are tired. So throughout the day, as you use your jaw and you try to eat, they get more tired, and then you eventually get a headache or a neck ache. So I do get those, but not as much. There was actually a period of time, about 2 weeks, where I wasn't in any pain at all, which is huge for me. So, and so I just kind of have to just kind of see how it goes, and hopefully once I get the splints in and everything's all lined up, then that will probably be less. So I go to the oral surgeon May 10th, and then I go back to the orthodontist May 16th. Now, my teeth started to separate here and here since my last video. So I called the orthodontist, and they said, come on in. And so they put a power chain on my upper teeth, and you can't see it because I got all this wax right here. Because let me tell you something, these braces and the upper braces, they cut up my lip if I don't wear wax all the time. But I can't wear wax all the time because I got to go to work. So I wear it as much as I can. I'm in no rubber bands, by the way. So I had to go back to orthodontist, even though I wasn't supposed to, and they put a power chain on my upper jaw, which hurt like so bad. I just was squeezing my hands because they just, I'm sure you guys possibly have had power chains already. They just pull the rubber band from here all the way around. And when you've had upper jaw surgery and you're only 4 months post-op, it hurts. So they did that to close up the gaps that were forming here. And the gaps were forming because I was not in rubber bands anymore. And the orthodontist was trying to see where my teeth were going to go. And sure enough, they started to separate. So he put the power chain on, and I still have my original appointment, which is May 16th, to see what's going on. I was supposed to have more brackets removed, but I'm not too sure what's going to happen now on May 16th. On May 10th, I go see the oral surgeon just to kind of check things out. So I'll have to let you know what happens with that. And then I don't go see the TMJ specialist until the braces are off. And then I get molds for the splints, and I go into those right away. I will be in an upper and lower, which I haven't had before. I've had an upper once, or no, a couple times, and I've had a lower once. But now I'm doing both at the same time to keep the load off of my joint at night. So, pros to having the surgery done. Well, my bite closes. You can see that. I see on my wax. So that's a good thing because before it was open, I can eat blueberries, which not that I never used to be able to eat blueberries, because when my teeth came together before in the wrong jaw position, I ate blueberries. Didn't even think about it, but I had an open bite for about 3 years, so I couldn't chew a blueberry. Even though it's soft, still couldn't chew it. So I can eat blueberries. I can eat some sandwiches. I can actually bite into a peanut butter and jelly sandwich. I can still bite into a hamburger, but I gotta be really careful about chewing, and I'll get to that in a minute. I can eat raspberries, rotisserie chicken. I can eat some strawberries as long as they're soft enough. And then I can't eat any chicken, which it stinks. I mean, I can eat soft chicken, like rotisserie chicken, but other than that, the chicken that I cook at home, unless it's in the crock pot, then I can eat some of it. I'm in, like I said, less jaw pain. Well, actually, I'm in no jaw pain and less headaches. I can eat more fried potatoes. I can eat as much of that as I want. So it slowly gets better. And when I say slowly, I mean so slow that you almost feel like you're not getting better at this point, because you kind of hit like a brick wall in your recovery, and then it's just super slow. You just wonder if it's ever going to get any better. So I'm still hoping that it just continues to get better and better. When I chew food, it feels like I'm chewing like rubber. And it's getting a little bit better now, but it was really bad, probably for the last month, I want to say, because it just is uncomfortable, like, feeling. And the reason why the TMJ specialist told me is because my upper jaw is still somewhat spongy bone. So when you chew, it's like squishy bone. So once that really hardens, I won't have that feeling anymore. So I've been told. So that's a good thing. So a lot of things that I can eat now, like I can eat pastas without cutting it up like last time, and it's just getting a little bit easier to chew it, and a little bit faster because you're a slow eater when you haven't chewed in so long. Chewing is difficult. Tearing is difficult to do at this point still. So I can't eat any real vegetables unless it's soft, but I did have Brussels sprouts, and I hadn't had those in a long time. So when I think about it, there are very good things that I can't eat now that I couldn't eat before. So that is definitely an improvement. I can't bite into there's no way I could bite into an apple because it's just up here. It's just too tender with the braces and the healing of the jaw still. So numbness. I was completely numb in my last video up here, but now I'm about 30%. I can feel that. And then my teeth are the same as the last time, as a month ago. Maybe a little bit more. I can feel my teeth a little bit more. My upper palate is about 60%. I think last time it was like 40%. So it's about 60%. So that's getting better. And in my last video, I was still real tender up in here, and I am not tender at all anymore. Thank God, because it really is painful when you're tender in here and you want to blow your nose or something. I do have some numbness in here still, up in here, but it's better. But like all up in here is I want to say completely normal. And it's still tight up in here, but it's not as tight as it was. So that's an improvement. Yay. So I'm just hoping it just keeps on improving. I can't have a cleaning until 6 months post-op, which really stinks because you get so much plaque buildup in between your teeth because of the braces, and I just want to get a cleaning so bad. So I have to wait 2 more months. My muscles do get sore from the clenching at night and then trying to chew during the day. They get sore, and my neck muscles still do get sore. And that just, hopefully once I get the splints and the orthodontist works on getting my bite together, like, and balances it, and the splints are balanced, and hopefully all of that will be under control and I can eat more, because that's why I did the surgery, so that I can eat more. So I'm just holding on to that hope. And my ear on this side, more than this side, gets really, really stuffy, especially if I chew a lot. It just feels like there's a bunch of wax in there, but it's really not, because the muscle gets tight and it pulls on your ear muscles and your inner ear muscles, and they start to spasm even though you don't feel them spasm. I mean, they are, and that causes stuffiness in your ear. So that, I don't know if that's going to go away or not. I can eat potato chips. Like, I can physically chew them, but it's very uncomfortable, which is kind of sad because I love potato chips. So hopefully as time goes on, it'll get more comfortable. I can eat like a handful of potato chips, and then I'm just done. Like tonight I tried to eat chicken and pizza, and I can do it. It takes a lot longer, and it takes a lot of energy. And so you kind of get to the point, for me at this stage in healing, that I just kind of like, oh, forget it. It's just too difficult. And so the oral surgeon did tell me that if that happens, then I'm not ready to eat it. Which is kind of torture, because when you see pizza or you see chicken and you just want to eat it. My teeth come together now, and I would like to eat food and gain weight, but I have to take it slow, and I have to learn right now what I can and can't handle. And then as time goes on, he told me that things will get better. Of course, they always tell you things will get better, so I'm just hoping that they do. That's it for now. If you have any questions, feel free to ask me. I do have appointments in May, and I will do an update after I see the oral surgeon and go to the orthodontist and hopefully get this power chain off and some more brackets off. Maybe, maybe not. And until then, I just kind of have to deal with the clenching at night and try to do some relaxations before I go to bed, and wait for the splints to come after I get my braces off, which should be soon. So that's the update for now. I don't think I'm missing anything. I went over numbness. Yeah, so I will keep you updated. Thanks for watching. Oh, let me just go ahead and show you my bite. There it is. That's me smiling with the wax. It looks really funny. And before I was very open. So that's it, and I'll see you next time. Bye.